Assalamu alaikum wa rahmatullah. My name is Syed Ehtasham Junaid. I'm a consultant radiologist based in the UK, and I work in the Princess of Wales Hospital in Bridgend, near Cardiff. I'm really delighted to be giving this opportunity to chat to you guys. I remember doing this a few years ago, and it was very well received. So what do I want to be talking today to you about? Essentially about the opportunities in the UK that are available for new medical graduates from Pakistan. Firstly, the key thing that you should be aware of is that the most essential qualification to get into the UK is GMC registration. The GMC is the General Medical Council. This is equivalent of the PMDC or the former PMDC. And the GMC regulates doctors in the UK, and they offer the licensing to practice in the UK. There are two key elements to getting GMC registration. One is the English requirement, which is IELTS, in which you need to get 7 in each category and an average of 7.5, or OET, which is a different type of exam, which is considered, it's a bit more clinical, and some people find that a bit more easier to pass than the IELTS exam. That's the first part, the English requirement. And following that, you need to also have the PLAB exam, which is the PLAB 1 and PLAB 2. PLAB 1 exam is an MCQ paper, and that's done in Pakistan as well. And following that, there is a PLAB 2 exam, which is a practical exam, a bit like OSCE or PACES if you are used to having practical exams. And combining of those two examinations with the English requirement and fulfilling some other minor requirements, but the English and the PLAB exam are the two key things to getting a GMC registration. You can also get GMC registration instead of passing the PLAB. You may have MRCP or MRCS or some other UK recognized exam such as the FRCR. So having these and the English exam will allow you, are the two main hurdles of getting GMC registration. Without GMC registration, you cannot do any work in the UK. You can do observerships. We have people from Pakistan who come and do observerships, so they can't actually do any clinical work, so they can't operate, they can't see patients per se. They can only observe, a bit like a student, so they can just observe. But to actually be able to do any clinical work, to do any fellowships, etc., the key thing is having GMC registration. Now, you've got two categories of people who will be applying to the UK through the fresh graduates, so who are those who have just finished medical school and are thinking of coming to the UK. And those who are sort of been established in their practice of medicine in Pakistan for some time, and they are thinking of coming to the UK. But if you're a fresh medical graduate, I would highly recommend that you complete your house officer jobs within Pakistan and get the house job certificate. That really helps you in getting full GMC registration once you've passed your exams. If you've not got the house job, then you then have to do another 12 months in the UK, which is again more tricky because you have to organize an extra level of work, which you can have easily organized in Pakistan. So, for example, if you are in your part of your medical college, you'll be attached to a hospital in which you will complete your house job. You complete that and get the house job certificate, and that will be valid for you in the UK. So those are and the other category of people are those who have been practicing medicine for some time. They may be surgeons, maybe physicians or radiologists, and for them, perhaps doing the PLAB exam is not necessarily appropriate. The PLAB exam is relatively straightforward. It's aimed at a medical school level, so the clinical knowledge and the examinations and the MCQs are very much straightforward medical school knowledge. However, if you're really sort of further down and you don't think that the PLAB exam is suitable for you, then consider doing the MRCS or the MRCP, for example, or even the FRCR. These exams are definitely longer and more expensive compared to the PLAB exam. And certainly comparing this to the US, and I'm sure there'll be people talking about the US system, the PLAB and the GMC registration and working in the UK is a much quicker route if you want to work abroad. It's certainly it doesn't cost as much because there are only two exams. The PLAB 1, which you can sit in Pakistan, and PLAB 2, you have to come to the UK. to do that. So that's sort of really, in terms of cost effectiveness, certainly some people borrow money, some people have limited funds. And so certainly there are other advantages of going to the US, and I'm sure other people will elaborate on that. But the key advantage in the UK, working in the UK, it's much closer to Pakistan. There's a bigger Muslim and Pakistani community, far bigger in terms of concentration in the UK, and also the quality of life and standard of living is reasonably good in the UK, and there's a lot more parity in the UK. There's certainly the thing about the US; it's well known for high-paid jobs as a consultant, because the system is pretty much private. But then that has its own disadvantages if you're raising a family. But nonetheless, UK is a very, very good place to live and raise a family, especially if you have want to raise them in some Islamic principles, or there are plenty of good schools and plenty of even Islamic schools. And somebody was joking that a lot of people in the UK, the Muslim community, end up sending their kids to Islamic schools, whereas when they're in Pakistan or elsewhere, they send them to different types of Cambridge schools and things. But the point I'm trying to make is that there's a lot more options from a family point of view in the UK. I can't speak on behalf of what happens in the States, but certainly I know the United States is a much bigger country, so things are more spread out from that point of view. So once you've got your GMC registration and you're sort of eligible to work, whichever route you've taken, what sort of opportunities are there? Because of Brexit and COVID and various other things, and a lot of pressure on the system, there's certainly increase in demand for the doctors. Now, one of the routes that people can take to come to the UK is IMT. And these are essentially some mini fellowships which people come and work in the UK for a limited period of time. They don't necessarily have to have passed the PLAB exam, but they can only work in the UK for a short period, and then they have to go back. That is certainly a good option for some people, but that doesn't allow you to settle in the UK if you are interested. And so that's another option, and then those are very limited in place. That is the only issue. But if you've got the more long-term solution for you to sort of work in the UK in a much more smoother way, is certainly getting the PLAB, or whichever way you get the GMC registration. Once in terms of opportunities for new trainees and new graduates, once you would come here, you'd have to do the local house jobs in order to get full GMC registration. Normally, a lot of that is bypassed if you already have got a house job certificate. Following that, there are plenty of opportunities in internal medicine, even some surgical positions, previously in the past, there were very few opportunities, especially in the more competitive fields. That is now becoming more and more easier to get into for international medical graduates, because a lot of the doctors are leaving the UK, partly because there are a lot of European doctors and they've gone back to Europe. And a lot of British doctors, some of them are going to Australia and New Zealand as well. So that creates a gap for international medical graduates, especially from Pakistan, to come in. I know I work in radiology, and we've got a huge deficit of radiologists, and that deficit is partly being filled significantly by Indian doctors. A lot of Indian doctors have got FRCR, and in fact, so the Royal College of Radiologists sets an exam in India, so you can actually sit the FRCR exam in India, simply because they've got a huge population of radiologists who are willing to pass the exam and come and fill the posts. And there's no reason why Pakistani doctors can't do the same. So there's certainly opportunities in pretty much most fields now. Like anything else, when you're an international medical graduate, you are on a back foot, because there's clearly a disadvantage of not knowing the system, not being aware of some of the nuances of working in the UK. But the key thing is that you need to find a good mentor. The good thing is that there are plenty of Pakistani doctors in the UK, and from all spectrums of who've been here for many, many years, or those who are very fresh. And so there's plenty of guidance out there, lots of Facebook groups and lots of meetup groups where people will guide you on the latest in terms of the developments, and even having support. I know lots of new fresh medical graduates, they sort of live together and try to pass the exam together, and then so they have a nice friendship group as a result. And so UK is certainly a good bet to certainly have come in for training. I would certainly recommend, if you're interested in training opportunities, and if you're a trained consultant already thinking of coming, of trying out the UK, I'd certainly try some of the more MRCP, MRCS routes if PLAB is not a possibility. I know some senior doctors in Pakistan who are very specialist, but they managed to pass the PLAB exam because it's a pretty straightforward exam. A lot of people consider the UK simply because it's much, from a visiting family back in Pakistan, it's much easier. You know, you can catch a direct flight from PIA in 7 hours, or an indirect flight from Dubai or some of the Middle Eastern countries. Within 11 hours, you're in Pakistan. So it's much more easily compared to, say, some of the people who live in the States. For them coming to Pakistan, it's probably a bit more tricky. It takes longer. And they are much more spread out. Yet there's a good Pakistani community in the States, and there's lots of support. And so you should do what works for you. Some people have friends and family in the UK, and that really helps them sort of get onto that ladder of working here. And some have them in the States. So that's sort of the overall information on sort of what to expect. Lifestyle-wise and expenses, UK is a reasonably a good place to live in terms of this. We have got high taxes, and some parts are more expensive to live than others. But again, the salary of a doctor is enough to get you by, and you can put a deposit towards a house, and you can work towards raising a family, and all of those sort of things. Certainly, as you go on further on, there's plenty of extra work and opportunity to supplement your income by doing extra shifts, locums, private practice, depending on whichever field you're in. I'm more than happy to answer any questions if you have any, and I really hope you enjoyed this. Just to summarize, in terms of what you need to be aware of, the key milestone to getting to the UK is the GMC registration. There is a route without the PLAB, but that's a temporary route. You'll only have allowance for 1 or 2 years to come and do a specific role and then go back. So that route you can explore, especially those who are struggling to pass the exams, or who don't really plan to come to the UK. They only want a small amount of experience. That route is actually much smaller, and the availability is more competitive, and so it is worth exploring, especially those are available in internal medicine, where the hospital may have a gap where they want somebody who's a senior or mid-level resident who will come and work in the UK for a little while, and then they'll go back. It's win-win for both. The hospital gets a doctor working on helping them out, and the doctor from Pakistan or the international graduate gets experience working in the UK. On that route, you can't apply to stay straight away. There are some you have to go back and then reapply. But those are sort of two main routes. And from the GMC point of view, PLAB's probably the easiest and the more cost-effective way, especially for young graduates. And certainly plenty of opportunity. As a radiologist, we've got plenty of radiology opportunity, especially if you're already a qualified radiologist. It might be a bit more difficult to get into as a radiology trainee straight away. I know lots of international medical graduates who are, in fact, one of my residents is from Kashmir, Azad Kashmir, and he has worked in the UK only for about 1.5, 2 years, and now he's on the radiology residency program. So it is possible, and if you are a qualified radiologist, I would highly recommend, if you can, try to get the FRCR under your belt if you're thinking of working in the UK. I hope you found that useful. If you have any further questions, please feel free to get in touch with me, and I'll be also available to answer your questions. Thank you so much. Assalamu alaikum.